Hello, everyone, and welcome to another episode of A Day with Your Fertility Specialist. I'll be your host for today, and I am Sabina. And joining us today is the amazing Dr. Jane, a minimal invasive surgeon and a consultant gynecologist here with us at Alps Hospital. Welcome, Dr. Jane.
Thank you, Sabina.
So, on today's topic, we have fibroids. I'm sure every woman, in fact, everybody must have heard at one point or the other fibroids, especially women of reproductive age. You hear fibroids, and please, can you unravel this mystery that is fibroids? Can you explain what they are to the layman?
Fibroids generally are non-cancerous growth that you see in that grow from the muscles of the uterus. They the causes are just commonly genetic, and the major things that feed them is the hormones of pregnancy. The hormones which women produce during their cycle, commonly
Okay.
estrogen and progesterone. Yes, and also genetic reasons that also feeds these things. So their impact generally depends on where they are, their size, location, and all of that. So they are not cancerous growths. They are benign growths found in the muscles of the uterus or on the uterus or in the lining of the uterus. So it depends. Location also differs, and their symptoms presentations also depends on where they are found on the body of the uterus.
Okay, I heard you mention is genetic, which means it can be passed down from parents to children.
Yes, commonly you can have that from if it runs in the gene. You know, the fact that one of the common things, if just being a black woman predisposes you to fibroid growth.
Okay.
Yeah, so sometimes it can run in the family, sometimes it can just be sporadic. You just come find yourself with a fibroid growth. I told you most of the hormones during menstruation, that's the hormones found in women of reproductive age groups,
AGS.
commonly estrogen and progesterone, feed these fibroids and help them to grow. So every woman in a reproductive age group, which is ages 15 to 49, is at risk of developing fibroids and all that.
Okay. So, at what point is fibroid? Are they deadly? Fibroids.
Well, fibroids, they can come with some symptoms depending on the location. So yes, when you say deadly, that might so they can be symptomatic.
Okay.
They can affect the quality of life, but they are not they can cause some symptoms that can be life that can affect you, but you can't they are not typically life threatening if well
Okay.
managed. Yes,
Okay.
so typically they will come with heavy bleeding, they can come with pain during periods, they can affect fertility. So yes, they can affect quality of life generally, but when you say deadly, they are not. They are things that can be managed comfortably. Yes, there are symptoms when overlooked can now become problems. Say for instance, a woman with heavy bleeding,
Okay.
you watch her bleed significantly to the point that her blood level becomes so short, then you're having anemia. You're
Hmm.
now dealing with anemia that can lead to heart failure and all its attendant sequelae. So you see, when it's neglected, it can be catastrophic, but it can be managed. So yes, quality of life affected, but life threatening, not all the time.
Okay. You also mentioned in the at the beginning that there are different types of fibroid depending on the location. So, can you explain these locations of the fibroids?
Yeah, so let's see the uterus as a structure that has three layers. So we talk about the inner layer, which
Okay.
is most like the lining of the womb we hear about where the baby sits in pregnancy.
Okay.
Then we have the muscular part, the majorly the body of the uterus or the womb as it were. Then we now have the outer parts, the covering or say the skin of the covering
Uterus.
of the uterus. So now fibroids can be seen in those parts. You can see a fibroid just on the outer part of the uterus. So those are subserous fibroids. Commonly they would cause pain
Okay.
because they will be compressing on structures surrounding them. Then, so you hear women talk about chronic pelvic pain and all. Then you can have those ones in the uterus, muscular part of the uterus. Those ones are solely in the muscles of the uterus. Then you also have those that are very close or in or causing some indentation in the
The
lining of the womb.
uterus.
Those are very close. Those are called submucosal fibroid. Those are typically
Okay.
known for causing heavy menstrual bleeding, if irrespective of the size. So a small fibroid sitting there can cause significant bleeding compared to a fibroid sitting in the muscle of the uterus. Of course, yes, they can also be found in some also awkward locations that can affect fertility. We talk about a fibroid sitting on the around the opening of the cervix, so that can affect it, or sitting somewhere around the opening of the fallopian tubes.
Champions.
They can cause they can affect the natural progression of pregnancies and also impact fertility.
Wow, that's very insightful to see how sometimes even the smallest of them can cause significant bleeding. Also, few days ago, I was on TikTok and I heard a pastor saying the reason women get fibroids is because they use contraceptives, and it's probably because they have done some kind of prostitution. Maybe that is why they have fibroids. So, could you debunk these statements made by some of these internet
Yes, going
professors?
by what we have said so far, that is absolutely untrue. That is not the reason. So we have established that it can be genetic.
Yes.
Commonly, the hormones seen in women of reproductive age group fits this fibroid so they can grow. And of course, they are not cancerous. They are not. It's not anyone's fault. Whoever develops fibroids, just because you have the genetic predisposition, and you can see it run in families. It can just be sporadic. A lady in a family without no one has ever had a fibroid, so it can just be anyone, and not because of any reason, but because you have a womb, you have the hormones, you are genetically predisposed. In fact, being an African woman alone predisposes to fibroid.
Okay, so does it mean you mentioned that being an African woman alone predisposes us to getting fibroids? So does it mean it doesn't really happen to or white women
Yeah,
doesn't
so
really?
there's something called about genetic predisposition. So the black race is
Okay,
predisposed to fibroid growth. But you see, there are some conditions common with some races. Then when you go to the white, you also have some conditions that are
come
also
on with
common
it.
with them. So
Okay, so how do we diagnose fibroids?
so fibroids, the diagnosis is can be is clinical and radiological, of course. So clinical, we mean history. You can take you ask the woman, she tells you, I have this growth in my tummy, or I notice my bleeding, my period's coming heavy, it's now prolonged, or she tells you, okay, I've been trying to conceive one thing or the other. No, not that fibroids would typically cause affect fertility, but I've told you that the location. So
Yes,
some of those things can happen. Then the woman comes with chronic pelvic pain. Then you now go on to examine her. At examination, you feel a mass or a growth in her, or a bulge in her lower belly, or a very big one, or they'll tell you that growth, that I noticed that something is growing that has been there for a while, and all of that. Then when you examine them, then you now go ahead to do your investigations. On ultrasound scan, they are easily diagnosed and all of that. Then depending on the extent, you can go ahead to do even bigger other investigations aside the ultrasound scan. You can go ahead to have MRI, because when you have large masses or fibroids, they can
yes.
also compress surrounding structures like the tube that takes urine from the kidneys to the bladder can be compressed, so you can have those compressive features, which can be picked also by all those investigations. So it's a stepwise thing. From the history, your examination tells you the next step. So you do your scan, you pick the fibroids if you suspect there are bigger masses, and you also want to exclude other conditions. Yes, so much more investigations will be done.
Wow. Okay, so how about during pregnancy? How do fibroids affect pregnancy?
Well, fibroids can affect pregnancy in some kind of way. So fibroids can make pregnancy journeys one with a lot of pain, because you have the blood supply to these fibroids is diverted to the growing baby. So they tend to now be short of supply. So that's what we call red degeneration of fibroids. So you hear a woman with fibroids and having pain. Then you can also have these fibroids sitting in locations that can affect implantation and cause repeated miscarriages
Miscarriage.
in women. Yes. Then these fibroids alone can make the placenta sit in wrong location. So normally we have appropriate sites where the placenta should sit. So that can predispose them to also bleeding in pregnancy, having their babies delivered by cesarean section, because if placenta is not sitting in the right place, it can also cause preterm labor. So a woman can go into just because of having fibroids. Then you can also after the pregnancy, post delivery, women can bleed in pregnancy because these masses they sit in the muscles of the uterus and prevent them from. There's a way the uterus closes up to prevent bleeding following delivery. If that is affected, because these masses prevent this
Closing.
natural process of contraction of the uterus, it can predispose women to bleeding and all of that.
This is a very, very insightful topic, and I'm sure at least one of us must have heard of a woman that has been struggling with any of these symptoms Dr. Jane has mentioned. So, if you know somebody that would benefit greatly from this session, please invite them to come join us because this is a very wonderful knowledge sharing session. So, how do we treat fibroids, Dr. Jane? How do we
And
treat them?
so, yes, fibroids generally can be managed. So you can decide. So there are different things. So some women, some fibroids are just found incidentally on examination. So woman comes with a
Okay.
different condition, you say, okay, on this scan I can see a fibroid. Obviously she's not symptomatic, so your management determines on the woman's symptoms and other care, other concerns she has. So a woman that is not symptomatic, she means she doesn't have any pain, no bleeding, no concerns. You can do watchful waiting. Remember that
Okay.
a whole lot of women have fibroids. What makes the difference is those that present with symptoms or those that are just fine. Yes, so you can just watch them. Then, depending on the symptoms they have, you can also do medical care where you give them medications for those that have heavy bleeding, those that
Okay.
have pains. They can do medical management, also some form of conservative treatment. Yes, there's also the option of surgery, taking out the fibroids, which is called myomectomy. Then, for women that have completed their family cycle or reproductive careers, you can go ahead take off the uterus. Remember, even after
Okay.
myomectomy, the fibroids can still grow. Yes, we said we had established that once you have a uterus and a woman within the reproductive
Yes.
age groups,
Yes.
you're producing hormones, so the fibroids can still grow. So that you had a myomectomy or a fibroid surgery doesn't mean another scan might not reveal a fibroid.
Fibroid.
Of course, it takes time to grow because they don't grow super fast. So you see a small one after a while because the hormones are still feeding it, it keeps growing and growing. So women that have completed their reproductive careers can have the fibroids removed. Then the location of the fibroids, aside open surgeries, you can also remove fibroids at procedures like hysteroscopy,
Okay.
especially when the fibroid is sitting and indenting into the lining of
The
the womb.
uterus.
Yes,
Yes.
so that is also a minimal accessory. So you are without a scar and all of that. Then there are also fibroids that can be removed laparoscopically. So not every woman gets a cut. This size also determines the kind of surgery you would have. Of course, there are also newer surgeries that can be done. You have techniques that can just dissolve or melt these fibroids, and also a whole lot can be done in the management of fibroid. But of course, your treatment is individualized per patient.
Okay, thank you very much, Dr. Jane. So, if you were to advise women now, what symptom would they look out for? I know you have mentioned bleeding, pain in the pelvic region, but what symptoms should be pressing enough for you to go to the hospital to check if you have fibroids, especially with family history also?
So a young woman stays and she notices that there's a growing mass in her belly, or she just feels like a hard something growing there. It's okay to want to find out what it is. Then of course the heavy bleeding, you some formerly your period would last 3 days, you use like 3 sanitary towels or four in a day. Now you barely can spend more than 2 hours with a pad, or you have significant pain. Yes, there can be pain, serious significant pains in the lower abdomen. Yes, it's natural. So we build this culture of checking. Yes, even if you're
Okay.
not checking fibroids, there can be other causes of similar conditions, but these are typical ways fibroids can present, and it's okay to seek medical attention.
Okay. I also always hear like, for example, now if you go to terminals, you hear them on speakers how one medicine can solve a lot of problems. So I know a lot of women would have heard that herbal medicine can melt the fibroids. How true is this?
Okay, that is not a true statement. Herbal medicines don't melt fibroids. Even when we discussed about treatment of fibroids, I talked about drugs.
Yes.
Those drugs generally they don't take care of the fibroids. They
Fibroids.
take care of your symptoms. They take care of the pain. They take care of the bleeding. Yes, that is what they do. But the go-to treatment is removal of the fibroids or removal of the uterus entirely.
Okay. So
Well, of course, removal of fibroids can be through any of the routes you had
mentioned
mentioned. It can
earlier.
be
Yes.
minimally invasive, it can be open surgery.
So you guys have heard Dr. Jane. Instead of taking different drugs that would impact your kidneys and livers, better you just come to the hospital for proper evaluation and diagnosis. Okay, so to the final question. So for the woman who has just been told she has fibroids and immediately fears she may never have children because of the fibroids, what is your advice to her?
Yeah, so fibroids, when you have fibroids does not affect your chances of getting pregnant. Yes, so a lot of women can go ahead to get pregnant spontaneously with fibroids coexisting with pregnant, and that is why I have some of those impacts of fibroids on pregnancy, right? Then when you have fibroid surgeries, you it doesn't also stop you from getting pregnant, except the fibroid is significantly impacting on your tubes. And by the time this fibroid surgery is done and you have some blockage or obstruction, that's when it's going to affect you. But fibroids can coexist with pregnancy, but they are important. They are taken out when you are planning some treatments, fertility treatments for some
Yes.
other reason, but that's not the case we're discussing now. Then people can go ahead to have pregnancies, have live births with even after fibroid surgery. So yes, you've been diagnosed with fibroid, you can get pregnant, you can have your babies, you can have your children even after fibroid surgeries.
Okay, thank you very much, Dr. Jane. This has been a very wonderful and insightful session. At here at Alps Hospital, we render all of these services that Dr. Jane has mentioned: laparoscopy, hysteroscopy, myomectomy, and the likes. So these procedures are not just for women that are looking for children, not just for fertility and patients, but if any of these your medical conditions is impacting the quality of your life, it's best you seek the consult of a doctor. And here at our hospital, we have the best of the best. We have a consultant gynecologist and the facilities to manage any of these symptoms perfectly. So thank you very much, Dr. Jane, for this wonderful session.
You're welcome,
We
Samina.
hope to see you next week, Wednesday, same time, 3 p.m. on our YouTube or Instagram pages or our Facebook pages also. So that'll be all for today, guys. Thank you very much.